Have you ever experienced that confusing moment after climax where everything seems the same, but when you look, nothing has come out? That silence, that unexpected emptiness, can seem like a simple quirk of age, a sign that your body doesn't work like it used to. But the reality is much deeper and deserves your immediate attention. Losing semen during orgasm is not an accident, nor a sign of weakness, nor something to be ashamed of. It is a silent message your body is trying to send, and listening to it can make the difference between ignoring a problem and detecting it in time. Many men over 50 experience this, and many more stay silent, thinking it's normal. However, science and clinical experience show that it can be the first warning of hormonal changes, neurological damage, surgical aftereffects, or even more serious conditions, which sometimes develop without pain or other visible symptoms. Imagine John, 57 years old, active, with a full and healthy sexual life, who one day notices that the pleasure is still there, but in the end, the semen doesn't appear. Surprise and concern mix with fear and embarrassment. Unbeknownst to him, his body is sending an early warning, a kind of internal red light that needs attention. Understanding that this is not a failure of masculinity, but a biological signal, is the first step to regaining control over your health and confidence. Moreover, it's not just about sexual function. Dry ejaculation can reflect broader changes in your body, from subtle hormonal imbalances to urinary or neurological complications. Ignoring it would be like driving a car with the oil warning light on. The engine seems to run, but if you don't act, the consequences can be serious. That's why every word you read here is meant to help you understand what is happening, how to interpret it, and what concrete actions you can take to protect your virility, well-being, and peace of mind. Before continuing, I'd love to know something to connect with our community. What city or country are you watching from? Write it in the comments. I love getting to know the people who truly care about their health, and this allows me to create more useful and relevant content for you and your region. Let's get straight to the point. Before analyzing what might be going wrong, it's essential to understand how your body should work under normal conditions. Knowing the standard is the only way to identify what deviates from the norm. Ejaculation is not just a sexual act, it is the result of a complex and perfectly orchestrated biological mechanism involving the brain, the nervous system, and the male reproductive organs. Each phase is designed to fulfill a specific purpose, and any alteration can produce changes that, although silent, have a profound impact on your well-being. During the accumulation phase, the seminal vesicles and the prostate produce and store semen, a fluid composed not only of sperm, but also of essential nutrients, such as fructose, which gives them energy to fulfill their reproductive function. It's as if the body prepares an energy cocktail that not only allows fertility, but also ensures that orgasm is pleasurable. Then, during the emission phase, this fluid travels through the ducts to the urethra, a journey that, although brief, requires precise coordination of muscles and nerve signals. Finally, the expulsion phase involves rhythmic muscle contractions that push the semen outward, while the bladder neck closes to prevent urine from passing. If any of these steps fail, even minimally, the result can be an incomplete or absent ejaculation without necessarily diminishing pleasure. Think of it like a precision clock. Every gear must work in harmony. If a single gear gets stuck, the clock keeps moving, but it doesn't show the correct time. Many men perceive these changes as things that come with age or small accidents, without realizing that their body is sending signals that require medical attention. A common example, Michael, 61 years old, had always had an active sexual life. A few months ago, he began to notice that, although he reached climax normally, the volume of semen decreased and, on some occasions, disappeared completely. He didn't feel pain, but the sensation of emptiness caused anxiety and doubts about his virility. After being explained how ejaculation works and that his experience could be due to benign or treatable alterations, Michael understood that he was not failing, but that his body was talking to him, and with medical guidance, he could recover both confidence and sexual quality of life. Additionally, understanding this process allows you to identify early warning signs before they become serious problems. Knowing how your body should function is the first step in making informed decisions about your health, from diet and exercise changes to specific medical checkups that can prevent silent complications. Recognizing the difference between normal and abnormal not only protects your sexuality, but also your overall well-being. When pleasure is present but semen doesn't appear, a confusing experience arises that many men endure in silence: dry ejaculation. This phenomenon, clinically defined as the absence of visible semen during orgasm, can occur occasionally, progressively, or suddenly, and although it does not always cause physical pain, it produces a significant emotional impact. Anxiety, frustration, and a sense of lost virility are common emotions because outwardly everything seems normal, but inside, something has changed. Think of it as turning on a faucet that should release water and noticing that, even though you turn the handle hard, nothing comes out. Pleasure continues, but the feeling of completion is affected, leaving an unexpected emptiness. This metaphor helps to understand that the body is still functioning, but the result does not match the expectation, and this is not your fault nor a sign of weakness. There are multiple reasons why this can happen. Some are benign, like certain medications that relax the muscles involved in ejaculation or mild hormonal changes, while others require more specific medical attention, including surgical aftereffects, neurological damage, or internal anatomical problems. Even previous cancer treatments, especially for the prostate, can change the way semen is expelled, even though sexual desire and the ability to maintain an erection remain intact. A realistic example: Robert, 64 years old, noticed that his orgasms were just as intense, but the semen volume had disappeared after a minor prostate operation. At first, he felt embarrassed and avoided discussing the topic with his partner, fearing a loss of masculinity. When he was explained that this was dry ejaculation, a condition that can have benign causes and, in some cases, possible solutions, Robert experienced immediate relief. He understood that he had not lost his sexual ability, but that his body had simply changed the way it manifested it. In addition to medical causes, it's important to remember that this experience can affect confidence, relationships, and self-esteem. Listening to your body and seeking professional guidance is an act of self-care and responsibility. It's not about avoiding embarrassment, but about recognizing the information your body is giving you and acting before small, silent changes become bigger problems. Maintaining open communication with your partner and proper medical follow-up are essential steps to regain security and peace of mind in your sexual and emotional life. One of the most common and often overlooked causes of dry ejaculation is retrograde ejaculation. In this condition, orgasm occurs normally, pleasure is maintained, but the semen does not follow its usual path outward. Instead of being expelled, it is diverted into the bladder. It's as if the body has an invisible detour on a highway. Everything works, but the flow takes the wrong direction, accumulating inside instead of being released. The main culprit of this phenomenon is the bladder neck, a small but crucial muscle that normally closes firmly during ejaculation to prevent urine from mixing with semen. When this mechanism fails, whether due to muscle weakness, previous surgery, or the effects of certain medications, the semen backs up and ends up mixed with urine. Many men discover this condition when they notice their urine appears cloudy after orgasm, something that can cause alarm or confusion if the cause is not understood. The reasons behind retrograde ejaculation are varied. Prostate surgery, especially transurethral resection, although effective for relieving urinary problems, can alter the muscles or nerves that close the bladder neck. Some medications, such as certain blood pressure drugs or treatments for urinary issues, can unintentionally relax this area, allowing semen to take the wrong path. And we cannot forget neurological problems. Diseases such as poorly controlled diabetes, multiple sclerosis, or spinal injuries directly affect the signals that coordinate ejaculation. A concrete example: Albert, 62 years old, sexually active, began noticing that his orgasms remained pleasurable, but ejaculation had disappeared after a prostate surgery. Initially, he felt embarrassed and worried about having lost his virility. After evaluation, retrograde ejaculation was confirmed. Understanding that it was a physiological change and not a sexual failure gave him immediate peace of mind and allowed him to resume his sexual life with confidence. From a practical standpoint, diagnosis is relatively simple. A urine test immediately after orgasm can confirm the presence of sperm. Although in some cases there is no definitive solution, adjustments to medication or specific therapies can improve the situation. Even for those wishing to conceive, reproductive medicine offers safe alternatives to restore fertility. The key is understanding that retrograde ejaculation does not mean a loss of virility or sexual ability, but rather a change in the way the body manifests climax. Additionally, it's important to maintain a positive psychological perspective. Understanding that this phenomenon is a signal and not a failure helps reduce anxiety and embarrassment, improve communication with your partner, and make informed decisions about health and fertility. Every small sign your body gives deserves attention. Interpreting it in time is an act of self-care and respect for yourself. Another silent but significant cause of dry ejaculation is obstruction of the seminal vesicles. These small glands, located behind the bladder, are responsible for producing between 60 and 70% of the semen volume, including essential nutrients like fructose, which feed the sperm and provide the energy needed to fulfill their function. When these pathways are blocked, whether due to inflammation, scarring, or malformations, semen cannot exit properly, even if sexual desire, erection, and orgasm remain normal. It's like trying to pour a bottle through an invisible cork. The content is still there, but it cannot flow, and the result is frustrating and confusing. The causes of this obstruction are multiple. Old infections, such as poorly treated prostatitis or sexually transmitted diseases, can leave internal scarring that narrows the ejaculatory ducts. Even small seminal stones, similar to kidney stones, can block semen flow without immediate symptoms. Some men are born with congenital malformations in the vesicles or vas deferens, preventing the normal passage of seminal fluid from its origin. Additionally, pelvic trauma or previous surgeries can narrow these pathways without the man realizing it immediately. An illustrative example, Javier, 66 years old, had noticed for years that his ejaculations were progressively reducing. Although his sexual desire remained intact, the semen volume decreased almost to nothing. A transrectal ultrasound revealed a partial obstruction due to an old inflammation. With a minor endoscopic procedure, the passage was cleared and his ejaculatory function returned to normal. This experience shows that often what happens inside is invisible and requires specialized studies to be detected. From a practical point of view, the most useful studies include transrectal ultrasound to visualize the size, shape, and content of the vesicles, magnetic resonance imaging in complex cases, and semen analysis showing reduced volume or absence of fructose. Additionally, it is advisable to keep a record of changes, including ejaculation frequency, volume, and semen consistency, as this information helps specialists detect patterns and possible causes. Psychologically, understanding that obstruction is a physical and treatable problem helps reduce anxiety and guilt. Knowing that it is not a loss of masculinity, but an anatomical change that can be corrected, allows men to take action without feeling ashamed, fostering confidence and emotional well-being. In addition, maintaining healthy habits, such as an anti-inflammatory diet, proper hydration, and regular exercise, can support prostate and vesicle health, reducing the risk of future obstruction or inflammation. Hormonal imbalances, especially the gradual decline of testosterone, are another silent but increasingly common cause of dry ejaculation in older men. Testosterone not only regulates sexual desire and erections, but also plays a crucial role in semen production and in coordinating the muscles that expel it during orgasm. It's like the fuel for an engine. If it drops too low, the system still works, but with less strength and efficiency. When testosterone levels fall below the optimal range, changes can be subtle at first and mistaken for normal age fatigue. However, the signs are detectable: reduced semen volume, less intense orgasms, a sense of emptiness during ejaculation, lower energy, irritability, insomnia, loss of muscle mass, and increased abdominal fat. Ignoring these signals is missing an opportunity to improve quality of life and sexual health. An example, Henry, 63 years old, began noticing that his orgasms were less satisfying and that semen volume was gradually decreasing. Additionally, he felt more tired and discouraged during the day. After a comprehensive hormonal analysis, hypogonadism was detected. His total and free testosterone levels were below normal. With a personalized treatment plan that included testosterone gel and recommendations to maintain healthy habits, Henry recovered not only semen volume and orgasm intensity, but also his vitality and overall well-being. From a practical standpoint, hormonal tests should preferably be done in the morning when testosterone levels are highest. In addition to testosterone, it is advisable to measure LH, FSH, prolactin, and thyroid hormones to get a complete picture. Depending on the diagnosis, treatments may include hormone replacement therapy, injections, patches, or gels, as well as strategies to preserve fertility and stimulate natural sperm production. Psychologically, recognizing and treating a hormonal deficiency can have a profound effect on self-esteem and sexual confidence. Understanding that a decrease in desire, energy, or semen volume is not a loss of virility, but a treatable medical condition, allows men to regain control over their body and intimate life. Additionally, adopting daily habits such as regular exercise, a balanced diet, and stress management helps maintain optimal hormone levels and improves sexual function and overall quality of life. Although many causes of dry ejaculation are benign or treatable, there are situations in which this symptom may be the first sign of more serious, even potentially severe, problems. These include tumors of the urogenital system, including the prostate, bladder, and testicles. In their early stages, these tumors often cause no pain or bleeding, making subtle changes in ejaculation the first possible warning. Reduced semen volume, pain during ejaculation, or the appearance of blood mixed with semen can precede more obvious symptoms. To understand this better, imagine your body as a perfectly calibrated system of pipes. Any obstruction, even minor, alters the flow. In the case of a tumor, even if it does not yet cause noticeable discomfort, it can interfere with the ejaculatory ducts or pelvic nerves, modifying the usual ejaculation pattern. Detecting it early can make a big difference in prognosis and allow more effective early interventions. Furthermore, neuropathies, meaning damage to the nervous system that controls sexual function, represent another critical cause. Diabetes, especially when poorly controlled, is one of the main culprits. Autonomic diabetic neuropathy can affect the nerves that command contraction of the muscles responsible for ejaculation, causing not only dry ejaculation, but also erectile dysfunction and loss of sensitivity. Other neurological diseases, such as multiple sclerosis, Parkinson's, or spinal injuries, can similarly compromise the ejaculatory reflex. Finally, although less frequent, some autoimmune diseases can directly affect the internal structures of the male reproductive system. Conditions such as systemic lupus erythematosus, scleroderma, or rare vasculitis can generate chronic inflammation, fibrosis, or tissue hardening, making semen production and expulsion difficult. Even uncommon granulomatous processes can interfere with seminal anatomy, causing silent symptoms that only specialized diagnosis can reveal. A fictitious example, Raoul, 68 years old, began noticing a decrease in semen volume and a sense of incompleteness during orgasm, without pain or other apparent symptoms. After medical consultations and specialized studies, a small early-stage prostate tumor was detected. Thanks to early detection, he was able to receive effective treatment and preserve his sexual function and quality of life. This story illustrates how an apparently minor symptom can be key to identifying serious health problems, emphasizing the importance of not ignoring changes in sexual function. Psychologically, understanding that dry ejaculation can be an early warning sign helps reduce anxiety, promotes responsibility for one's own health, and reinforces the idea that seeking medical help is not a sign of weakness, but of self-care and prevention. Every signal your body sends deserves attention and action because listening to it can save lives and improve sexual and emotional quality of life. Faced with any of these situations, it is crucial not to minimize symptoms. If dry ejaculation appears suddenly, is accompanied by pain, blood in urine or semen, unexplained weight loss, significant urinary changes, or general discomfort, immediate medical evaluation is essential. Ignoring these signs would be like running a red light. The risk exists and every moment counts. Acting in time not only protects your sexual health, but also your overall well-being and, in some cases, can save your life. Think of your body as a book that speaks in its own language. Every symptom, no matter how small, is a letter forming a message. Dry ejaculation may be just one word or the first sentence of a broader warning. Listening carefully and consulting a specialist is interpreting that message correctly before its content becomes more complex. A concrete example, Frank, 65 years old, noticed that his ejaculation had changed dramatically, with reduced volume and mild pain during ejaculation. Initially, he attributed it to age and decided not to consult. After a few weeks, symptoms worsened and blood appeared in his urine. Medical evaluation revealed a complicated infection that required immediate treatment. Acting early at the first change could have prevented progression and the associated anxiety. From a practical approach, it is recommended to keep a record of changes, note dates, semen volume, color, presence of pain or blood, and any other associated symptoms. This record not only helps the specialist identify the cause, but also provides the man with a clear view of what is happening in his body. Additionally, maintaining healthy habits such as regular exercise, adequate hydration, and balanced nutrition reinforces reproductive system health and improves response to physiological changes. Psychologically, recognizing these signals and acting strengthens confidence and reduces feelings of helplessness or shame. Seeking medical help is not an act of weakness, but of self-care and personal responsibility. Every action you take by attending to your body is a step toward regaining your well-being, confidence, and full sexual life. Listening to your body in time turns a silent sign into an opportunity for improvement, strengthening both your physical health and emotional balance. After everything we have explored, there is one thing that must be completely clear. Ejaculating without semen is not a coincidence nor a simple quirk of aging. It is a symptom, sometimes mild and harmless, other times the first sign that something deeper might be happening in your body. We have seen how dry ejaculation can be caused by a wide variety of factors: previous surgeries, side effects of medications, internal obstructions, hormonal imbalances, neuropathies, or even oncological diseases. The important thing is to understand that, in all cases, it should not be ignored. Every change in sexual function, from decreased semen volume to orgasm intensity or the total absence of fluid, is valuable information your body is giving you. Listening to it and acting is an act of care, responsibility, and self-love. It is not about shame or loss of masculinity. It is about taking control of your health, your well-being, and your sexual life. A motivating example: Jason, 67 years old, had been worried for months about the decrease in his semen volume and the sense of emptiness during orgasm. At first, he avoided talking about it, even with his partner. After seeking medical guidance and undergoing thorough tests, he discovered that his situation was reversible thanks to hormonal adjustments and a minor endoscopic procedure. He regained his ejaculatory function, but most importantly, he regained confidence, peace of mind, and personal satisfaction. His story demonstrates that every symptom can be an opportunity for improvement, and it is never too late to take action. Psychologically, understanding this transforms the perception of sexual changes. You are not less of a man, you are not too old, and you are not alone. Recognizing a symptom, interpreting it correctly, and seeking help turns worry into action, anxiety into knowledge, and fear into confidence. Maintaining healthy habits, consulting specialists, and communicating with your partner are practical steps that strengthen both your physical health and emotional well-being. In the end, your body speaks even from the most intimate places. Ejaculating without semen is a message that deserves attention. It is not a failure, it is information. And if you listen to that message in time, it can become an opportunity to regain your vitality, peace of mind, and sexual fulfillment. Sharing this information also helps other men who, in silence, are going through the same thing. Because male health is not a luxury nor something that disappears with age. It is a right, a responsibility, and an opportunity to live fully.